Hello and welcome to Outcomes of Nursing Excellence. This is our part of our 2-minute EBP challenge at Ed for Nurses. You can join us and get your own 2-minute EBP challenge by signing up right on our homepage there at edfornurses.com. Well, hello and welcome. My name is David Woodruff. I'm the president of Ed for Nurses, where we empower nurses to become extraordinary. Find us on Facebook by going to facebook.com/edfornurses, and you can check out our blog there and connect with us in many other ways. Well, today what we're talking about is nursing excellence. And there's a study that in particular that we're going to look at that looked at how nursing excellence affects some of our physiologic type of data that we have in our patient. In this particular study, they found that 7-day mortality in neonates in the neonatal intensive care unit was positively affected by nursing excellence. Nosocomial infections were decreased when we paid attention to and were working on nursing excellence. Severe intraventricular hemorrhage was decreased as well in these neonates. However, 28-day mortality was not affected by the changes in nursing excellence. So what are we talking about here? We're talking about a structured nursing excellence pathway. So we're not just talking about, hey, let's be all about nursing excellence here. No, they're talking about an actual structured commitment from the facility that they were going to commit to nursing excellence. Specifically, they looked at 2 particular programs from the ANCC. This is the American Nurse Credentialing Center, the Pathway to Excellence, and Magnet. What they found, well, first of all, let me back up here for a moment, just tell you a little bit about what the ANCC says. The ANCC says that facilities that have gone through this process of becoming credentialed as nursing excellence centers have found improved nurse satisfaction. They have found that there is more, or you get better choice nursing staff and leaders that stay as part of this process. They cultivate interpersonal teamwork, or interprofessional teamwork, champion high-quality nursing practice, and support business growth. So these are the benefits that they say that hospitals can achieve by having this designation as a nursing excellence center. So what kind of things are necessary in order to be able to achieve nursing excellence? Well, the American Nurse Credentialing Center says that these are the things that have to be in place in order to be a center for excellence. First of all, the nurses need to control the practice of nursing. Okay, that seems pretty obvious to us, doesn't it? Okay, but in many of our hospitals, nurses don't control the practice of nursing. It's controlled by somebody else. It's controlled by the business people. It's controlled by physicians, but it's not controlled by nurses. So number one is, and in order to get this designation, the hospital has to show that the nurses in the facility are controlling the practice of nursing. So that may be a CNO, a chief nursing officer, that is controlling the practice of nurses, but in fact somewhere in that facility nurses have to be involved, and that CNO has to be involved at all levels of the organization to be able to control the nursing practice. The work environment is safe and healthy. Okay, so we're getting back to this idea of having a culture of safety. And, of course, that we have to have a safe work environment. So safe work environment not only means that it's free of obstructions or having things in the ground that we're going to trip over, but also that we have put systems in place to address patient care and practice concerns. So if there is a problem somewhere, for example, somebody makes a med error, we put a system in place that is going to try to prevent that error from occurring again in the future. Okay, so all these things are necessary in order to have a center of excellence. In addition, that's just the first 3. There's 12 of them. Orientation prepares new nurses for the work environment. So we can't have orientation systems where people end up at the end of that orientation process not feeling like they're ready for that work environment. So whatever the work environment is, critical care, med-surg, whatever the work environment is, our orientation process has to prepare new nurses for that work environment. So we may have to extend the orientation, put residencies in place, have internships, whatever the case may be, so that our new nurses are ready and prepared for that work environment. The CNO, the Chief Nursing Officer, is qualified and participates in all levels of the organization. So all the way down to the staff level, they have to participate. In some of these organizations that are designated as Centers for Nursing Excellence, we have our CNOs coming out to the floors on a weekly basis talking to staff nurses to find out what the problems are, what's going on, what are the problems, what can we do to try to fix them. So we're not just ignoring them or sitting in an office somewhere and going to meetings and not having any connection with the staff nurses. Professional development is provided and used. So it's not good enough just to provide professional development for our staff. We also have to have staff that are using that professional development. Okay, so this kind of falls back on you as the staff nurse a little bit too, that you're saying, oh boy, okay, my role here is I've got to use the resources that they're giving me. So when resources are provided, we need to be using them, finding ways we can fit that into our life, into our career. Equitable compensation is provided. Of course, we all hope that would be the case. Nurses are recognized for achievements. So part of this whole process is that nurses need to be recognized. So hopefully our administration or our education department are doing those things. If not, you can get involved in starting to recognize your peers and find some ways that we can do this professionally. So talk to your educators, talk to your managers and say, hey, how can we recognize the achievements of our peers and of ourselves? And how can that be recognized on a staff unit basis? For example, some units will have all of their certified staff recognized by posters or placards and things like that in their unit. So we want to find ways that we can recognize the achievements of our peers. A balanced lifestyle is encouraged, so we're not encouraging people to do crazy things like work double shifts and not take breaks and things like that. By the way, if you're considering not taking a break while you're at work today or tomorrow or the next day, consider this. The American Association of Critical Care Nurses has studied and found that you actually are more productive. You get more done. When you take that lunch break, that 30-minute lunch break, you're actually more productive. Isn't that something? Because a lot of times we feel like, nope, I can't take my lunch break. I've got too much to do. But you actually get more done in the day when you take that lunch break because you get some time to stop, to refocus, and to re-energize, and you come back to work, and you're more energized and more focused, and you actually get more work done. Collaborative relationships are valued and supported. Certainly we would hope that our managers and our administrators are going to support collaborative relationships, but hey, that falls back on us too. We need to start that collaborative relationship. We need to work in that collaborative relationship. So often we're waiting for somebody else to come and collaborate with us. But you need to start that process. You start that process with your physicians and with your peers like respiratory, etc. When they come out onto the floor, ask them questions about your patients. Don't just ignore them. I see so many of these people coming to our floors all the time, and everybody just ignores them. It's like respiratory is invisible. It's like, all these dietary, etc. They're all invisible until we need them, right? Okay, we need to develop that collaborative relationship ahead of time before we need them. Our nurse managers are competent and accountable. Certainly we would hope that to be the case. If that's not the case, if you feel like the nurse managers in your hospital are not competent and accountable, then it is your duty to go to school and become a nurse manager. Okay, so we need better nurse managers. You say, yes, okay, then go to school and do it. Because we could certainly use somebody who is going to be competent and accountable. We have many, many, many good competent and accountable nurse managers. But if you feel like that's not the case at your institution, then it is your duty to go back to school, to get the training, to get the education, and to fill that role. A quality program and evidence-based practice are used in our facility. We can encourage that by bringing evidence back to our practice. Read the journals, subscribe to the 2-Minute EBP Challenge, and take this stuff back to work with you so that you can help to keep your peers evidence-based and to be using quality information at the bedside. Now, a specific, measurable quality program also has to be instituted at your facility to meet this requirement. Please understand that efforts at personal excellence are going to lead to better patient outcomes. So don't sit back and say, wow, that's a lot of stuff that my facility has to do. I'll sit back and wait until they do it, and then we'll have better outcomes. No, this is about you, personal excellence. You need to work on that to develop better patient outcomes in your patients. Certainly there's things the facility can do too, but that's in addition to what you do. He says, I would have been here sooner if it was not for the wonderful caring nurse in the hospital. That's what kind of outcomes we want to have all the time, right? Let's prolong our patients' good quality of life by having great nursing care. And you can do that by starting to implement some of these recommendations from the American Nurse Credentialing Center. If you'd like to find out more about this study, you can in JAMA 2012. It's a study by Dr. Lake and colleagues called the article, rather, is called Association Between Hospital Recognition for Nursing Excellence and Outcomes of Very Low Birth Weight Infants. You can get free nursing tips sent right to your cell phone by texting 86677. In the body of your text, type in nursing tips. Right there it is, nursing tips, 86677. I want to thank you for joining me for this edition of our 2-Minute EBB Challenge, Outcomes in Nursing Excellence. My name is David Woodruff. Thanks for joining me, and until next time, bye now.